Fatigue, something that many of us deal with, and most of us self-medicate. You see, as we've talked about, apnea, waking you up at night, can cause chronic fatigue because it happens over and over and over again. Let me explain the difference between acute and chronic, since those are clinical terms. Acute is something that happens right now. It's an in-the-moment type of an event. Chronic is something that happens consistently over time, more like a habit, if you will. So when we say that someone has chronic fatigue instead of acute fatigue, it means that they've been experiencing that over a long period of time. Days to weeks to months to years. You see, an example of acute fatigue is a doctor who's doing the residency in a hospital and has to work a 48-hour shift. Now, I don't know about you, but I can't remember the last time that I stayed up 48 hours straight. That seems pretty painful. So when a doctor does that during the residency, we know that that moment, the day or two following, they will be experiencing what we would call acute or momentary fatigue. But on the flip side, let's use a person who's had apnea, say, for the last 5 years. Their apnea-hypopnea index is, let's say, 15 on the more mild to moderate side. So 15 times per hour, once every 4 minutes, that person is waking up throughout the night, hour after hour, night after night, day after day, year after year. So in 5 years, that person has actually woken up thousands of times throughout the night and been completely unaware of it. So we know that over time, our bodies will seek to get used to anything it possibly can. Our bodies are really smart in the way that they've been designed, and that they will find a balance no matter how crazy the environment. If you go hours or maybe a day without drinking water, our body will naturally take the water that's within itself and start to use that over time. No different than sleep. If we're used to getting a standard 8 hours of sleep and feeling amazing when we wake up in the morning, and over time we start to fragment that or break that up little by little, section by section, night after night, it's very hard to be aware of how that's occurring and what time frame it's occurring in. Just think for a second. When is the last time you woke up and felt like $1,000,000? You woke up with enough energy for the day, excited to start the day, and what was ahead for you? No question of, can I hit the snooze button? You woke up before the alarm with plenty of energy ready to go. Can you remember that day? Now, there are a multitude of things that can affect how we sleep and the quality of our sleep. Apnea is only one of those. But if it's affecting our sleep, it can do that quite frequently and have quite an impact over time. Chronic fatigue is one of the most difficult things to be self-aware of, meaning it's very hard for us to understand how badly we are sleep deprived if it's us who are experiencing that sleep deprivation. So if you don't feel like $1,000,000 in the morning, like you want to go climb a mountain or run a mile, maybe it's time to ask your doctor, is there something going on here, and dig a little deeper.